Good evening, everyone. My name's Dan Marsala. I'm a RRT at UMass Memorial Medical Center, and this is my um, presentation on cystic fibrosis. So, what is cystic fibrosis? Cystic fibrosis is a chronic disease that primarily affects the lungs and digestive system in people with this condition. In the United States, there's more than 30,000 children and adults that have cystic fibrosis, and worldwide, there's more than 70,000 people living with CF. The CFTR protein helps maintain the balance between salt and water on many of the body's surfaces. When it doesn't work correctly, chloride becomes trapped in cells, which then leads to the water not being able to hydrate the cellular surface. This leads to the mucus covering the cells to become sticky and really thick. People with CF have a defective CFTR gene that produces a faulty protein which causes the buildup of thick mucus in the lungs, pancreas, and other organs like the liver. So what are some symptoms of cystic fibrosis? One of which is very salty tasting skin, persistent cough with phlegm, frequent lung infections such as pneumonia and bronchitis, wheezing or shortness of breath, poor growth and weight gain even with a good appetite, greasy, bulky stools or difficult bowel movements, nasal polyps, chronic sinus infections, digital clubbing due to frequent hypoxia, rectal prolapse, and in males, infertility. So what are some of the genetics behind cystic fibrosis? So every person has 2 copies of the CFTR gene. This is called the cystic fibrosis transmembrane conductance regulator gene. CF is a recessive disease, which means that for a person to have CF, they must inherit a copy of the gene from both the parents that contain mutations in order to have CF. So if you only inherit 1 copy of the CFTR gene, that causes a mutation. You are a carrier. You're not symptomatic. You're considered a CF carrier. You don't have the disease or the symptoms, but you can potentially pass it on to your children if your partner is a carrier as well, or is or if they do have cystic fibrosis themselves. People with mutations of the CFTR gene have disruptions in the normal production of the CFTR protein found in the cells of the lungs and other parts of the body, and as mentioned before, this causes the buildup of thick mucus within the body. So when 2 CF carriers have children, the chances of the child having cystic fibrosis, as you can see in this picture here, is 25%. So 1 out of 4 kids have 1 out of 4 chance of your child having cystic fibrosis. You have a 50% chance that your children will be a carrier of cystic fibrosis, and then you also have a 25% chance that they're not a carrier at all. If one partner does have cystic fibrosis and one partner is a carrier, that greatly increases the chance that your child might have cystic fibrosis. That increases it to 50%. There is no possibility that your child will not be a carrier, so it's either they have cystic fibrosis or they're a carrier, so it's 50% positive or 50% carrier. So why is cystic fibrosis so dangerous? Due to this thick mucus buildup in your lungs, it can lead to difficulty breathing. It can also allow for bacteria to thrive in the lungs because it's trapped in this mucus. This can lead to severe lung infections, inflammation, and over time it can lead to severe damage and ultimately respiratory failure. Cystic fibrosis can also cause a buildup of thick mucus in the pancreas. This prevents important digestive enzymes from being released, and these enzymes are what help the body break down food and absorb nutrients. People with CF tend to have malnutrition and poor growth. Lastly, this thick mucus can also cause blockages in the bile duct of the liver, and this can cause liver disease. So, how do we treat cystic fibrosis? The treatment goals for CF include preventing and controlling infections that occur in the lungs, removing and loosening mucus from the lungs, treating and preventing intestinal blockage, and then providing adequate nutrition. So medications. There are medications now that target gene mutations and treat the most common genetic mutation that causes cystic fibrosis. We use antibiotics for treating and preventing lung infections, anti-inflammatories to reduce swelling in the airways, mucus-thinning drugs to help thin and expel secretions, bronchodilators to keep airways open, oral enzymes. These help your digestive system absorb the appropriate nutrients that you need. Stool softeners, which prevent bowel obstructions. Antacids, these help the pancreatic enzymes to work better. And then also specific drugs for diabetes and liver disease when appropriate. So airway clearance techniques. This is a huge part of, treating and just maintaining a healthy living style for patients with cystic fibrosis. You can do things like chest physical therapy by hand, as many respiratory therapists know and do frequently on patients. Or you can do, which many patients use now, and it's a great tool, is the high-frequency oscillating vest. This helps relieve mucus obstruction and clear the airways. Makes coughing up secretions easier as it helps move it into your main airways to expel. And by doing this, it helps reduce the occurrence of infections and inflammation. Another good tool is PEP therapy, positive end expiratory pressure. This, such as like the Acapella or the Aerobica. And just a quick example here of the vest therapy here. They have these nicer ones for home use, and then they also have the Curus, which just goes just right around the chest, doesn't have the actual whole vest. And that's an example of the Aerobica, the flutter valves and stuff like that. So surgical options, obviously, in severe cases, surgery may be an option for the patient. Some of these options in the most severe cases include lung transplant, liver transplant, bowel surgery for obstructions, and then also in the case of severe malnutrition, placement of feeding tubes, either nasogastric or actually surgical implantation of a feeding tube directly into the digestive tract. So a couple questions for you, just to kind of review. If both parents are carriers of the CFTR gene, what is the likelihood that their child will also be a carrier of the CFTR gene mutation? And then, lastly, why is it that the thick mucus caused by the CFTR gene mutation presents such a problem for CF patients? And then just a few references. I received my information from the CFF.org, which is the Cystic Fibrosis Foundation. Has a lot of great information on there on the genetics, the mechanisms of cystic fibrosis. And then also, as far as diagnoses and treatments go, from the Mayo Clinic, they also had some very good references and material. And that is my presentation. I thank you for your time.